This bill would have changed the entire first half of my life.
It shouldn't take missed childhoods, declining health, and silent damage for someone to be tested for something that can be found so much earlier.
On average, it takes 6 to 10 years for someone with celiac disease to be accurately diagnosed.
It would establish a 3-year pilot program to evaluate the inclusion of celiac disease screening during routine cholesterol and lipid screenings for 12-year-olds.
They're already getting a screening test at age 8 to 12, and they're looking for familial hypercholesterolemia, which affects 1 in 300. Celiac affects 1 in 100. So I think it makes sense.
Years of quiet damaging happening beneath the surface while I kept trying to live a normal life. But the reason it went undiagnosed for so long is because it didn't look the way people expected celiac disease to look.
The key here is that current medical practice is missing the majority of people who are affected. An essential challenge in diagnosis is that many kids don't present with the classic symptoms that clinicians typically expect.
There is this conception still, unfortunately, that it's sort of a white person's disease. And so we see that people of color, people of lower socioeconomic status have even a harder time getting diagnosed, and this has been documented many times. So I think this could really make a really big impact for the state, reaching some of these underserved communities.
Celiac disease doesn't wait. Every delay means more damage, more missed years, and more people still waiting for answers.
Remarkably, all children with undetected celiac disease remain exposed to the risk of short and long-term complications.
If we can pass this bill to ultimately improve early detection in children with celiac disease, we can help children and their families get support, care, management of celiac from a younger age, in return, less impact on their overall long-term health.
This program ensures that families who receive a diagnosis through the study will have access to education and support resources. Through this initiative, the Celiac Disease Foundation will provide families with trusted guidance on how to manage a new diagnosis.
This program really represents a milestone in the history of pediatric preventive medicine.
That diagnosis gave me something that I hadn't had before in my entire life. It gave me control. But it shouldn't take years to get there.